ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. ഇപ്പോൾ 1000 MCQ സീരീസിൻ്റെ പാർട്ട് 21 വീഡിയോ ആണിത്. ഇപ്പോൾ വീഡിയോയിലേക്ക് കടക്കാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ദ ലെവൽ ഓഫ് റെസിസ്റ്റൻസ് ഓഫ് എ കമ്മ്യൂണിറ്റി ടു എ പെർട്ടിക്കുലർ ഡിസീസ് ഈസ് കോൾഡ്. ദ ഓപ്ഷൻസ് ആർ ആക്റ്റീവ് ഇമ്മ്യൂണിറ്റി, പാസീവ് ഇമ്മ്യൂണിറ്റി, ഹേർഡ് ഇമ്മ്യൂണിറ്റി ആൻഡ് നാച്ചുറൽ ഇമ്മ്യൂണിറ്റി. And the answer is herd immunity, that is immunity of the community is herd immunity. For an example, herd immunity against measles require about 95% of a population to be vaccinated. The remaining 5% will be protected by the fact that measles will not spread among those who are vaccinated. And the next question, the study of anthropods is called. The options are epidemiology, entomology, ornithology and archaeology. And the answer is entomology. And ornithology is the study of birds. In the next question, night blood smear is usually taken to detect. The options are malaria, filariasis, dengue and Japanese encephalitis. And the answer is filariasis, because the microfilariae that cause lymphatic filariasis circulate in the blood at night. That is called as nocturnal periodicity. Nocturnal periodicity ആണ് microfilariae ഉള്ളത്. The next question, the minimum time interval required between two blood donations. The options are 1 month, 3 months, 6 months and 1 year. And the answer is 3 months, and this gap helped the blood to regain the normal hemoglobin count. ഇപ്പോൾ ബ്ലഡ് ഡൊണേഷൻ ചെയ്യാനുള്ള മിനിമം ഏജ് എന്ന് പറയുന്നത് 18 ഇയേഴ്സും മാക്സിമം അപ് ടു 65 ഇയേഴ്സ് ആണ്. ദ നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ, ORI മീൻസ്. ദ ഓപ്ഷൻസ് ആർ ഔട്ട്ബ്രേക്ക് റിയാക്റ്റീവ് ഇമ്മ്യൂണൈസേഷൻ, ഔട്ട്ബ്രേക്ക് റെസ്പോൺസ് ഇമ്മ്യൂണൈസേഷൻ, ഔട്ട്ബ്രേക്ക് റെസിപ്രോക്കൽ ഇമ്മ്യൂണൈസേഷൻ ആൻഡ് നൺ ഓഫ് ദിസ്. And the answer is outbreak response immunization. The next question, the test which is used to measure the amount of chlorine in water. The options are orthotoluidine test, toluidine test, hyperchloride test and chloride test. And the answer is orthotoluidine test. In the next question, the apparatus is used to measure the amount of bleaching powder to disinfect the well. The options are Burkett-Fill filter, Horrocks apparatus, Causative filter and none of the above. And the answer is Horrocks apparatus. The next question, method of cleaning rapids and filter is. The options are backwashing, scraping off, chlorination and none of the above. And the answer is backwashing, and cleaning in slow sand filter is scraping off. Rapid sand filter backwashing, slow sand filter scraping off ആണെന്ന് ഓർക്കുക. The next question, safety officer have to be appointed in factories where number of workers is more than. The options are 500, 1000, 2000 and 5000. And the answer is 1000. In the next question, small family nome is symbolized by. The options are red triangle, inverted red triangle, black triangle and inverted black triangle. And the answer is inverted red triangle. Small family nome means a family with 2 or less children. Mottos ഉണ്ട്, that is son or daughter 2 will do, second child after 3 years and universal immunization. In the next question, the normal range of pH in packaged drinking water as per Indian standard is. The options are 4.5 to 5, 5.5 to 6.8, 6.5 to 8.5 and 8.5 to 10.5. And the answer is 6.5 to 8.5. The next question, which of the following immunoglobulin responsible for anaphylactic reactions? The options are IgA, IgE, IgM and IgG. And the answer is IgE. അപ്പോൾ ഓരോ ഇമ്മ്യൂണോഗ്ലോബുലിൻസും അതിൻ്റെ ഫങ്ഷൻസ് നോക്കാം. ഫസ്റ്റ് വൺ ഈസ് IgA. That is main antibody on mucosal surfaces, example gut, respiratory tract and urogenital tract, and prevent pathogens from entering circulation, secreted in breast milk, providing immunity to nursing infants. And the second one is IgD, that is present in small amount in circulation, involved in regulation of immunoglobulin synthesis and function as an antigen receptor on unexposed B lymphocytes. Next is IgE, that is most important immunoglobulin allergic reactions and immunity against parasites. Allergic reaction വരുന്നത് IgE ആണ് and promote histamine release from mast cell and basophils. And next one is IgG. IgG is responsible for most specific antibody reactions in adults that may be passed from mother to fetus, which instills neonatal immunity. And the next is IgM, that is first antibody to be formed when B cells are activated, produced early in infection and neutralizes circulating pathogens and activate complement proteins. അപ്പോൾ IgM ആണ് ഫസ്റ്റ് ആൻറ്റിബോഡി പ്രൊഡ്യൂസ്ഡ് ഇൻ റെസ്പോൺസ് ടു എനി ഇൻഫെക്ഷൻ. അപ്പോൾ IgG മീൻസ് ക്രോസ് പ്ലാസൻ്റ ആൻഡ് ഫാഗോസൈറ്റോസിസ് ഓർത്ത് വെക്കുക. IgA ഇൻ സെക്രീഷൻസ് ആൻഡ് മ്യൂക്കോസൽ പ്രൊട്ടക്ഷൻ. ആൻഡ് IgE മീൻസ് അലർജിക് റിയാക്ഷൻ, ലൈസിസ് ഓഫ് പാരസൈറ്റിക് വേംസ്. ഓക്കെ, ഓർത്ത് വെക്കുക. Next question, causative organism of infectious mononucleosis is? The options are varicella zoster virus, toxoplasma, cytomegalovirus and Epstein-Barr virus. And the answer is Epstein-Barr virus. Infectious mononucleosis also called as glandular fever and is transmitted by saliva. The next question, the nurse explains that sickle cell crisis occur when sickle-shaped red blood cells, the options are rupture, produce hemoglobin S, interfere with the blood production and obstruct major arteries. And the answer is obstruct major arteries. Sickle cell crisis il sickle shaped red cells clump together and block the small blood vessels that carry the blood to certain organs, muscles and bones. This causes mild to severe pain. The pain lasts for hours to days. This is all about sickle cell crisis. And the next question, at how many weeks of gestation uterus reaches at the level of umbilicus? The options are 12 weeks, 20 weeks, 32 weeks and 38 weeks. And the answer is 20 weeks. And at 12 weeks, just above the symphysis pubis. At 16 weeks, in between the umbilicus and symphysis pubis. And at 20 to 22 weeks, at the level of umbilicus. And 24 to 26 weeks, just above the umbilicus. And at 28 weeks, in between the syphisternum and umbilicus. And at 36 weeks, at the level of syphisternum. And at a term or 40 weeks, baby drops and the fundal height at just below the syphisternum. This is all about fundal height. In the next question, Mission Indradhanush is program related to, the options are palliative care, antenatal care, immunization and mental health. And the answer is immunization, and the scheme this seeks to drive towards 90% of immunization coverage of India and sustain the same by year of 2020. So Mission Indradhanush related to immunization orkwa. The next question, inability to sleep is termed as, the options are dyspepsia, dyspnea, anorexia and insomnia. And the answer is insomnia. Next types of insomnias നോക്കാം. Mainly 3 types of insomnias ആണ്. acute, chronic and transient insomnia. First one is acute insomnia. It's otherwise called as short-term insomnia. It's a brief and occur because of the life circumstances. Acute insomnia can go to treatment without invasive methods. അതായത് മെഡിക്കേഷൻ കൊണ്ട് ട്രീറ്റ് ചെയ്യാവുന്നതാണ് acute insomnia. And the second one is chronic insomnia that happens at least 3 times per week and lasts for at least 3 months. There are number of at-home and professional treatment available for chronic insomnia, and it may involve medication or special therapies to address the condition. And the third one is transient insomnia. It is short-term and lasting up to 3 nights. Transient insomnia is temporary and sleep will return to the normal state on its own. There are 3 types of insomnias. The next question, which antiretroviral is to be avoided during anemia? The options are lamivudine, sidovudine, efavirenz and stavudine. And the answer is sidovudine because the sidovudine is the commonest cause of drug associated anemia. So anemia patient sidovudine recommend ചെയ്യുന്നില്ല. The next question, which day is observed as World TB Day? The options are October 30, September 29, February 14 and March 24. And the answer is March 24. 2021 തീമാണ് The Clock is Ticking. അപ്പോൾ അത് ഓർത്ത് നോക്കുക. The next question, which assessment finding noted by nurse on a stoma is normal? The options are pale stoma, pinkish red and moist stoma, dry stoma and dark colored stoma. And the answer is pinkish red and moist stoma. If there is pale or dark stoma means signs that the tissue is not receiving the blood supply. Immediately inform to the surgeon. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക. താങ്ക് യു ഫോർ വാച്ചിങ്. അടുത്ത വീഡിയോ ആയിട്ട് അടുത്ത ദിവസം കാണാം.